So the equipment that we use to be able to obtain a blood pressure, it starts with this wonderful word here, sphygmometer. This includes the blood pressure cuff and the dial is what you can see in the picture there. There are two types. There's an aneroid, which is what we will be using, and then there's electronic. Most of what we see in the office is electronic. However, it wouldn't be uncommon for a provider to ask you to back up that electronic reading with an aneroid reading. Aneroid tends to be more accurate. So with this equipment, you will have an inflatable cuff. You will have what's called a pressure bulb that is inside the cuff, and that's what causes the cuff to inflate and tighten around the arm. And then you'll also have a manometer, and that's what you use for the reading. When you purchase your stethoscope, you should receive your stethoscope with a blood pressure kit. Make sure that you're buying them both together. A stethoscope by itself, you're only going to be able to obtain a pulse. So you really want to get a blood pressure kit, which still should run about $20 or so. You can find them on Amazon, eBay. You can go to a medical store near you, but you will want to have your own stethoscope and blood pressure equipment. So let's take a look at the dial. This is the dial for an aneroid reading. And notice here that each major point is in increments of 10. So for instance, if we start here at 120, then what we'd see in between would be 130, counting in tens, 140, still counting in tens, 150, 160, and so on. Now, in between these increments of 10, we have smaller lines that represent increments of 2. So that would follow as 2, 4, 6, 8, and then your number in the form of a 10. So 120, 122, 124, 126, 128, 130. Keeps going in increments of 2 until we get to 10. Their blood pressure cuff, when you do receive yours, it should be calibrated for accuracy. And the ones that we use in the facility also calibrated for accuracy. This would be an aneroid blood pressure gauge. And we'll be spending more time on how to read these and for accuracy. Now here's your electronic reader, a lot easier to use, I know, but remember, less accurate. It does give a digital readout. And here you can see the systolic number is 117 over 74. This looks like here we have a pulse of 66. And then also it gives us an additional number, which is a pulse oximeter number of 92. This number here, we're not necessarily talking about, but just so that you all know what this is, this number here is measuring the amount of oxygen that's within the red blood cells. So 117 systolic, 74 diastolic, 66 pulse. And notice how all of these numbers really fall within a lower range, which is what we would expect. With your stethoscope amplifies body sounds that we know. We know that it's used to be able to make things louder. This is the anatomy of your stethoscope, pretty typical. Doesn't really matter how much money you spend. They're all generally built the same. What changes in the increase in price is going to be definitely the bell and definitely the quality of the tubing and how well it amplifies. Your blood pressure kit should come with its set of earpieces. These are interchangeable. They just pop out and you can put new ones in as far as what's comfortable for you. These are actually pretty hard. I prefer these, but they do have some that come more flexible. It doesn't matter which ones you use, as long as they go in your ear and down in your canal. You want them to fit quite snug so that you're blocking out outside sounds. You'll have your flexible ear tube here that works with the spring that allows you to open and close and fit it to your face. Going off into the tubing works its way all the way down into what's called your chest piece or your diaphragm. Now with this here, it is a two-parter. Notice you have one side that's larger than the other. So typically the smaller side is used for our low pitch sounds or our pediatric patients. The diaphragm, the larger side, is going to be used for high pitch sounds or adult patients. It does have here in this stem the ability to kind of click it from right to left, and that will turn the sound on and turn it off. So if you put your stethoscope on and you've got no sound, go back and just click that stem and make sure that you've got it in the on position. Very typical anatomy for a stethoscope, and you can fancy these up again by the tubing, the color, whatever you like, but I just wouldn't suggest that you spend a whole lot of money on these. Not now, anyways.